Receiving unexpected news from a medical test can definitely spark a lot of questions and maybe even a little worry. It is completely normal to wonder what comes next when you hear about something like an abnormal Pap test result. If your Pap test comes back abnormal, it means your doctor needs a closer look. The specific follow-up tests depend on what kind of abnormal cells were found and whether the human papillomavirus, or HPV, is also present. Most often, the next steps involve a repeat Pap test, an HPV test, or a colposcopy. The reason for these different paths is that not all abnormal cells are created equal. Many are just minor changes that resolve on their own, often due to HPV, which is very common. More significant changes, however, might indicate a higher risk of developing cervical cancer over time. Your healthcare provider uses the specific classification of abnormal cells, such as a SCUS, LSIL, or HSIL, to guide their decision-making process, ensuring you receive the appropriate level of monitoring or intervention. So, what might those next steps look like? For mild abnormalities, particularly if your HPV test was negative, your doctor might recommend a repeat Pap test in 6 months to a year, simply to see if the cells have returned to normal on their own. If your HPV test is positive, or if the abnormalities are more significant, you will likely be scheduled for a colposcopy. This procedure allows your doctor to examine your cervix with a special magnified instrument, often taking tiny tissue samples called biopsies to get a more definitive diagnosis. It is really helpful to understand that an abnormal Pap result does not mean you have cancer. It just means changes were found that need further investigation to rule out anything serious or to address potential precancerous conditions early. Catching these changes early through follow-up tests is key to successful treatment and maintaining your long-term health, as it allows for intervention long before cancer could ever develop. Always remember to have an open conversation with your healthcare provider about your specific results and recommended next steps. Understanding the why behind each test can help alleviate concerns and empower you to be an active participant in your health journey, ensuring you get the best possible care for your unique situation.